Okay, hi, and welcome everyone. Welcome to the COVID-19 vaccine, a warm welcome or the cold shoulder. My name is Kati, and I'm one of the co-chairs of the German-American event series 2020. Our motto this year is Neustart, or overhaul in English. We have chosen this motto for a variety of reasons. One is that we're trying out a new format and how we host our events this year. And in addition to that, Neustart is also a theme that is present in many of our events. And right now, if there's one thing that makes us really long for a Neustart, it is the ongoing COVID pandemic and all the hopes that are tied to a COVID vaccine. This event would not be possible without our amazing team before and behind the scenes in event planning, in communications, in digital logistics, and the general support that we get through Wunderbar Together Germany and the US, which is funded by the German Federal Foreign Office and implemented by the Goethe Institute. One brief note on logistics. We will have a participant Q&A towards the end of this event. So please ask questions, but please do that via the Q&A tool, and you can find that Q&A button on the bottom of your Zoom screen. We won't take questions through the chat. In the Q&A tool, you can also upload questions that you like and you really want to hear our panel answer them. Also, for everything that you share via the Q&A and the chat, please adhere to our code of conduct. And with that, I'll hand it over to Debbie, sorry, not quite yet.
Great. Welcome, everyone, and thank you for joining. My name is Debbie Budinsky, and I'm one of the organizers of this timely and exciting event on the reception and distribution of the COVID-19 vaccine in Germany and the US. We have a quick poll for our audience now to set the stage. Once a COVID-19 vaccine is approved in your home country, will you take it? Yes, no, or are you undecided? As we can see, there's some hesitation among our audience in terms of who will take the vaccine. Thus, despite the promising results from Pfizer and BioNTech, who just last week requested emergency authorization for the vaccine from the FDA, as well as those from Moderna, who will soon follow suit with an authorization request, it becomes clear that the success of these vaccines will depend on more than just their development. The public needs to want them. With airlines and postal services planning out storage facilities and transportation routes, it is quite timely to be discussing how the vaccines will be received and distributed. With us today to explore this theme as our moderator is Abby Gutnoff. She's the New York Times healthcare reporter, as well as the former bureau chief of the Miami and Boston offices. I will now turn this over to Abby to introduce our panelists.
Hello. Hi, thanks for having me join your event today. I'm thrilled to be here, and I am just about to turn to introduce our panelists. One moment, my Zoom is acting up a bit. Okay, so we have with us today Dr. Zira Madad, who is part of the New York City Health and Hospitals COVID-19 Tiger team that provides support in infection prevention, control, and emergency management. She also leads the health and safety team of over 1,800 contact tracers as part of the Enhanced Investigations Unit of New York City's contact tracing program, which I understand has been a real leader in contact tracing in the country. Moving on, we have Karl Lauterbach, who is a member of the German Parliament and professor of health economics and clinical epidemiology at University of Cologne. He is one of the leading experts on the COVID-19 pandemic in Germany and one of the most important policymakers in the containment of the pandemic. And we also have with us Wayne Koff, PhD, the founding president and CEO of the Human Vaccines Project, which is a nonprofit R&D consortium focused on decoding the human immune system to accelerate vaccine development. In 2019, Dr. Koff was named by Foreign Policy, along with the Obamas, Angela Merkel, and others, as one of the 100 global thinkers who have had a profound impact on the planet. Thanks. Back to you.
I think you're sorry. This is Tim from the off. I think Debbie, you're asked back in, but I think we should just get started on the questions from you, Abby.
Okay. One moment, please. Okay.
Okay.
So, starting out, I wanted to ask everybody an initial question about this, and that is, as we get closer to a vaccine actually getting through the approval process, several vaccines actually, and potentially starting to go out to hospitals around the country as soon as next month. Also in Britain, I understand, and maybe some other countries as well. How do you think the vaccine will be received once it is available in your home country? That's the million-dollar question, I guess. Who shall we start with? Dr. Madad, maybe you.
Yeah. First, good morning, or wherever you are, good evening or good afternoon. Pleasure to be part of this panel. So I think first, to answer your question, how is it going to be received? I think majority of Americans here in the United States are very optimistic of having a safe and efficacious vaccine. So if we're looking at some of the polls that have been conducted at certain intervals, in May, over 70% of Americans have stated that they would get the COVID-19 vaccine. If you look at another poll that was done in September, that dropped to 51%. And a lot of reasons why there was a big drop. I think one thing we can all think about is the political theater that has been playing out. But then the most recent poll done in November has shown a growth that 58% of Americans will accept a COVID-19 vaccine. So it's not going down, it's going up. And there are a number of reasons why individuals may be reluctant and weary of getting a COVID-19 vaccine. And I think all of those questions and concerns can be addressed through a robust public health communication and education campaign that is community-based. And just to give you a couple of examples, a number of Americans are concerned about the side effects. A number of them are also concerned about the safety. And they don't know if this is a platform that they want, with the novel platforms being used in delivery of and development of these vaccines, is it going to alter their DNA, right? So that's the one question I've been getting a lot from my own healthcare workers. Is this going to alter my DNA? Because we're hearing about these RNA-based vaccines. And I think once you start talking to them and telling them about the development process and what the safety is, that helps alleviate a lot of the concerns. But we shouldn't be having to do all of this in silo. There needs to be a very robust communications program that is able to talk to them, tell them about what there is and what there isn't. And the last point that I'll mention is everything, obviously, we have guiding principles: safety, efficacy, and making sure that's equitable. And those are some of the guiding principles, along with transparency. But if we're looking at just the safety, we have over 70,000 individuals that have gotten a dose of COVID-19 vaccine. We have good safety data. We're going to continue to have good safety data. But these are the key pieces of information that aren't being translated, aren't actually being communicated to alleviate a lot of these concerns. So I'll just leave it at that, but I think there's a lot more work to be done.
Thank you. Let's see, Dr. Lauterbach, how about in Germany? What kind of receptivity are you expecting? Oops, I think you are on mute still.
Well, first of all, thank you for having me on this panel. It's a great honor for me, and say hello to all of you. We don't really know currently how the COVID vaccines will be received in Germany, so I can only guess at that point. We have a couple of, let's say, polls, and these polls show, roughly speaking, a 50% willingness to take the vaccine. This, to my view, is on the disappointing side so far, but I think the numbers will increase. As a matter of fact, we will try to educate the population about the effects and the side effects of the vaccine. And we will basically be able to increase the trust of the population. This is my guess, because there's a large community of doctors, scientists, policymakers, politicians who are prepared to basically talk about the vaccines in all transparency. So we will have to admit that we don't have any long-term safety data yet. There is clearly no such data available, but we will basically, in my opinion, be well advised to point out the alternatives. While it may well be the case that there is rare and also very severe side effects of the vaccines, it is already shown and proven that there's not so rare and very common major, even deadly side effects of the disease and long-term disability. So you always have to compare the vaccine against the disease and not compare the vaccine against nothing. And in that sense, we will basically try to educate the population about what is at stake. And a large part of the population is becoming tired of the measures that we have to, that basically have to make mandatory. So if the population wants to get out of the mode of, let's say, having to live with these infringements on personal liberty and economic life and friendship and so forth, the pickup of the vaccines will not only be necessary, but will also be welcomed. And to share that information with you, I will be among the first who go for vaccination, because I think we should put our money where our mouth is.
And will you be very public about that, just in terms of sharing with everybody that you did receive it?
I think so, yeah. I mean, I'm not, let's say, high priority, but indeed, if I get the vaccine early on, I would venture to do that in order to make it public, that I believe in the vaccines. I also believe in the concepts that are currently proven. I'm in touch with, let's say, all of the current well-discussed vaccine makers. I believe in the vaccines, and therefore, I'm very well prepared to make that public at the point when I'm privileged to take one of these vaccines.
Great. Maybe you and Dr. Fauci will be among the first to go together. And Dr. Koff, what do you expect about public reception those first couple months in particular? And I'm curious too what you think about reception among healthcare workers, which we've seen some mixed polling on. And some, higher than I might have expected concern among healthcare workers about taking a vaccine.
Yeah, I think at the end of the day, Abby, I think the healthcare workers are going to take the vaccine. I think, as the other panelists have pointed out, if it's the option of the vaccine, which is extremely safe, just based on the data that we have seen, and the potential of a virus that is as deadly as this one is, ideally everyone's going to take it. Unfortunately, I don't think that is the reality, though. And one of the issues that has come up, at least in the United States, is as a result of the politics of the past 6 or 9 months, as Dr. Madad has mentioned. There really has been a leadership void, and ideally, what you want is the leadership right of. Outside of Dr. Fauci, there have not been a lot of the vocal voices in support. And if you look at the percent of individuals in this country who are really abiding by the wearing of the masks and the socially distant, that you do have about a third of the people in the country that that one would think are going to have a lot of questions about the vaccine, unfortunately. So I think we have a lot of education to do, and I think it's going to take all of us. But at the top of the line, it's going to take the leadership at the top.
Dr. Lauterbach, just quickly, I wondered, that's a good point. Do you see that same sort of political, distrust of the politics that may have been involved or that might have been perceived to be involved in rushing a vaccine to market in Germany? Is it a much different climate there in terms of trusting the process over the past 6 to 8 months?
Well, I haven't been in the US since February. I typically come all the time because I have an adjunct position at the Harvard School of Public Health, so I come every couple of months. But last time in February, I left and was unable to come back, as a matter of fact. So I don't know the spirit and I don't know the situation in the US other than, let's say, from talking to friends and, let's say, following the media closely. So that having said that, it is clearly a different spirit here. There's clearly in Germany, there is a small political group which is very, let's say, vocal, which tries to alienate the public from the vaccine safety data and also from the arguments that Dr. Koff was pointing out, which I fully agree with, which were also already shared by Dr. Madat. So I agree with my two panelists here that given the safety data that we currently have, that is way more encouraging than we could have expected. And that is the opinion that is shared by almost all political parties, left or right, in Germany. There is only one far-right party, the AfD, which is a populist party, very to the right, and they basically breed anti-vaccine sentiments, but they also try to belittle the COVID pandemic, and their views are only shared luckily by a minority in the population. But apart from that, I would say left or right, 90 to 95% of the political leaders will clearly not have problems with, let's say, accepting that the vaccine is the better option in comparison to the disease.
Interesting. Okay, thank you. Dr. Madad, any thoughts about how we might proactively counteract conspiracy theories that are sure to arise about the vaccines? And I'm sure many have arisen already. I know that some states in their distribution plans or planning process have talked about, they're going to put people in charge full-time of monitoring social media to see as they come up what conspiracy theories are out there and try to nip them in the bud. What are your thoughts on that?
Well, I think I'll first start off with, and this is something I've said, I think, in many different panels, is, being in this particular field, we all are very familiar with when you have these types of outbreaks and incidences, you're always battling two fronts, the contagion itself and then the contagion of misinformation. And in this particular pandemic, the contagion of misinformation has been just so widespread that having to constantly debunk a lot of these conspiracy theories has really been a full-time job for many people. And this is why science communication is so important. So there needs to be, and I mentioned this earlier, when we talk about the educational and community campaign, this is very much a grassroots campaign, if you will. And I actually just published on this last week with a couple of colleagues. And we talked about how we can involve the community to better debunk myths and provide factual, reliable information. And it all starts with very much a community-based approach, seeing who's in your community, seeing what information they have, and then making sure that they have the right and accurate information, and using trusted sources to make sure that they understand what is true and what is false. And so to give you an example, and again, a lot of this is not something new. We've done this for Zika, we've done this for Ebola and other types of infectious diseases, where you're leveraging local trusted health officials, those in the faith-based communities, educating them, giving them the information so they can serve as bridges to our communities to give them the factual information. There's so many means and ways of going about debunking information and making sure that conspiracy theories don't run wild, but it all boils down to making sure that you have the time and the effort and the right people at the right table giving the right message, right? So we don't want to have a politician giving this information. You want to have a trusted source. And while we want it to be a public health official, we understand that there is a lot of hesitancy, even among people of color who have been disproportionately affected by this particular pandemic. And they may not trust healthcare sources for many different reasons. And that's why you want to make sure you're leveraging partnerships within the communities to get this information out there.
Okay, sounds smart. Sounds like a big effort that's going to need a lot of coordination day to day even. Let's see, should and will the vaccine be free? I know there's somewhat different answers in different countries, but Dr. Koff, what are your thoughts about how this will it really be free to everybody who needs it?
Well, it should be free. And the issue is it really going to be free? The government has said it will be free.
Right.
So I think as the vaccines are going to come out, and again, there are going to be at least a half a dozen of the vaccines that are going to roll out over the next 3 or 4 months. There isn't any reason to just to think that there only are going to be the Moderna and the Pfizer and the AstraZeneca vaccines. It may be, a case by case, but I suspect the government is gonna make a real effort to make the vaccines free.
Right, as they have with COVID testing, although we've seen, as one of my colleagues has been reporting on, that's not always been the case. It's a little bit of whack-a-mole going on in terms of whether and how much people are charged for testing in this country. Dr. Lauterbach, I assume the vaccine will be completely free to anybody who wants it in your country?
Yes, there's no question. Vaccines, and I agree with Dr. Koff, we expect more vaccines to become available and to be very efficacious, and very effective. The vaccines will be for free, period.
Okay, no question there.
No question. No, we are waiting for the vaccines, and we will have to fight for uptake, but there is no question that the vaccines will be for free, no matter what.
Okay. This is a really interesting question. And any of you can jump in to answer this. Should there be special privileges given to people who opt to receive the vaccine, especially in the beginning, as it rolls out to the general public, such as the ability to dine indoors or to travel? Like, I assume people would be given some certificate proving they have been vaccinated, and those people could be given some sort of special privileges as an incentive. Does anybody want to jump in and say what they think about that? Good idea, bad idea? I know there's been some talk of paying people to get the vaccine too here in this country. It's just talk at this point. But are any of those sort of dangling incentives in offering privileges to people who choose it, are those a good idea?
So I'm happy to, so go ahead.
No, please go ahead.
I'll just briefly mention is, so I think that what we need to look at is this is rolling recovery, right? So not everybody's we're not going to all recover at the same time. This is going to be very much a rolling type of basis. I do not support that idea for a couple of reasons. And I think the best, and to compare to the antibody tests that we have for COVID, and initially people were thinking that, oh, you'll get this, passport of, I had COVID-19, I have antibodies, now I can go out and mingle freely in the public. And that is completely, not only a bad way of thinking, but it's also putting not only themselves, but other people at risk, because, I think that right now there is still a lot of questions than there are answers. And there's many different reasons why I think that's a bad idea, but I'll let my other panelists also jump in whether they agree or not to agree, but I don't support that in particular.
I don't support it either. I think there are still a lot of issues, a lot of unknowns about the vaccines. We don't know how long they're going to work for. And we don't know if they're going to work as well in everybody. And so the early data is extraordinarily on the positive side, but it still is really, really early data. And so I think we're gonna learn a lot over the course of the year as to how effective these vaccines actually are. It's really important, and we spend a lot of time at the Human Vaccines Project thinking on this issue and working on this issue, and that is, are the vaccines going to work in the elderly as well as in the younger adults? And the early returns are good, but it's still going to be a wait and see.
Yeah, I know there was some concern at the ACIP meeting last week. A couple people raised concerns about ruling the vaccine out to long-term care residents, long-term care facility residents first, just because that very frail elderly population has not been really studied in terms of receiving the vaccine. And I don't know, but I think that their disproportionate risk of dying from COVID sort of outweighs any concerns about giving them the vaccine first was the decision. Dr. Lauterbach, is this concept kind of foreign to you in Germany, the idea of paying somebody to get a health benefit or rewarding them somehow?
I think that this is not anything that any politician in Germany is well advised to even propose, because this is clearly setting the wrong incentives. We, together with, let's say, our vaccination committee, standing for a vaccination committee, and our government ethics board, came up with a priority list, and that priority list will first be served. That includes healthcare workers in the front lines, for example, nurses, but also ICU doctors and so forth, that takes the highest risk in the line of care. And we also will cover the, let's say, high risk elderly and the high risk, not so elderly, but chronically diseased patients. We will basically work from that list and go to the more general population from there. But there is no question that we will not give incentives to people who will not really need the vaccine, but want it in order to be able to be privileged to go on a plane or into, let's say, a festival or something like that. That is not, that proposal is currently not aired by anyone that I know.
Okay, sounds good. Curious, how do you all think that the US and Germany can collaborate moving forward in the vaccination effort? Clearly, there's been so much collaboration between the manufacturers and scientists in developing this first vaccine, the Pfizer and BioNTech vaccine in particular. Is there more we can do as two countries to collaborate in terms of making sure our populations are covered, are vaccinated? Or any other way that we might, that the countries might collaborate moving forward?
Yeah. One of the issues that has come up on this vaccine, which is a lot different than for any other vaccine, at least that I'm aware of, is the nationalism associated with the purchasing of the vaccine in advance. While I think everyone in the U.S. would like to get the vaccine, obviously, I think it's going to be equally important, and maybe this is where the two of the countries and some of the other of the G8 countries can also help, is to ensure the vaccine is given in the developing world and in the marginalized groups, because if we're gonna really eliminate the virus, the whole world's going to have to get this vaccine, or as much of the population as we're able to actually reach. And so there are institutions out there that are beginning to think about this, like at the WHO and Gavi and such. But I think this is going to be a logistics issue, a major logistics issue that I think is going to take some of the coordination of the leading nations.
Huge issue. Yeah, really interesting.
The one thing that I'll just add on, and definitely completely agree with what Dr. Koff just mentioned, is, with this nationalistic approach, we know that it's going to have long-term repercussions, not just from a public health standpoint, but also from a just politics standpoint. We know that, sharing and looking at it through a global health security lens has better health outcomes. And so I think that there certainly needs to be a change in the attitude and the approach that's being set here, particularly in the United States with this current administration. So, I do think, collaboration is really, really important in making sure everybody has access to a vaccine and it's equitable.
Great point.
Yeah, I agree with Dr. Koff's point that we really need to make sure that the vaccine is made available to the poorest countries and to the poorest in the rich countries, and that we are not basically distributing the vaccine according to the willingness or ability to pay. That would be a shame. The vaccines, by and large, have been developed with public money, I should say. For example, Moderna received quite some support, as I do understand, from the US government.
A lot.
And so did BioNTech from the German government. We heavily invested into BioNTech, and without these public money investments, the development would not have been possible in the time span that we look at here. So I think that the companies, they should really pledge to make the vaccines available at, let's say, very reasonable costs. And this is important because beyond the contingencies that have now been paid for or that have been covered by the governments, the prices thereafter will basically be market prices. It's different with, let's say, obviously the Oxford Astra achievement, which will be a non-profit distribution, which I very much welcome. This is wonderful that this is made possible, and I really hope that the 90% effectiveness in the small subgroup will ultimately will come to light, as a matter of fact. But the messenger RNA vaccines are expensive to buy and difficult and expensive to distribute. This even holds for the Moderna vaccine, even more so obviously for the deep cooling chain requirement of the BioNTech vaccine. So I hope that, let's say, COVAX and also Gavi and other, let's say, venues of distribution will make sure that the poorest in the rich countries and the poor countries, or not so well-to-do countries, that they will equitably be, let's say, taken care of, because it is often in these countries that the pandemic is out of control, and the data do not really bear the extent of the loss of control there, because very often we have poor data. So I fear the worst for some of these countries, and we have to make sure that this human achievement of having the vaccine so quickly is also shared by all of mankind.
Mm-hmm. Dr. Lauterbach, one quick follow-up on that. I'm wondering, is the perception in Europe that the United States has been particularly nationalistic in its approach out of the gate with vaccines? How are we as a country perceived in terms of like our willingness to be generous and share with other countries?
No, it's not perceived that way at all. Obviously, I would say most Europeans, except for, let's say, a couple of, let's say, smaller countries in Eastern Europe, but most Europeans, Middle Europeans, Western Europeans, obviously do have some reluctance to share the political views of Donald Trump, and therefore there is, let's say, some distrust about him. But this is limited to him and his government. But when it comes to the US population, to the US, let's say, scientific community, there is a wide agreement, at least in Germany, and I would think so for many other European countries. I travel a lot in Europe, that you share a lot, and you have shared a lot, because let's face it, a lot of the, let's say, groundbreaking research is research that comes from US institutions, and it was immediately shared by anyone. We took advantage of that. I have already frequently mentioned, for example, in the New York Times or elsewhere, that we managed the pandemic based on American studies, as a matter of fact. I mean, the studies that me and also my colleagues, we use in, let's say, advising our colleagues in the government are very often American studies, US-based studies. And don't forget that a lot of the trial data that were now collected are collected in the US, unfortunately, and in Brazil, for example, because the case numbers are so high there.
Yeah.
So in that sense, we fully, we are respectful, very respectful for the major achievements of, let's say, US research institutions. We are fully appreciative of, let's say, the volunteers in the American populations that were prepared to participate in the trials. And we do not regard the US as more nationalistic than many other countries, including our own countries. And we, even Germans, we have been nationalistic in the early days of the pandemic when it came, for example, to medical protection, equipment sharing, and so forth. So we have to look for ourselves. We don't conceive the US as particularly nationalistic by any means.
Okay, somewhat comforting to hear. Dr. Medad, I wondered, just because I'm so interested in this, I wondered if you know much and could share anything about what those initial weeks of distribution will look like in New York City. I assume that it will be major hospital systems who get those first doses, partly because of the cold chain requirements. And I just wondered if you could give us any picture of what, I say a vaccine starts to be shipped December 15th, what those first 2 or 3 weeks will look like in New York City.
Well, first, I think this is a very large collaboration with public health and healthcare delivery systems throughout the New York City region. And then secondly, this is not collaboration, but it's in lockstep. And so there are frameworks that are interim that have been established both at the city level along with the state level. The state level has, a 5-point plan in terms of how the distribution and the allocation is going to, not so much the allocation, but the distribution is going to go. There's more information that should be coming from our public health entities soon. And so that's what's going to be kind of the guiding light that's going to tell healthcare systems within the New York City region how to begin the administration of the COVID-19 vaccine. And I think, as mentioned by one of the panelists, even when we talk about vaccinating healthcare workers, I mean, we have 21 million healthcare personnel in the United States, and not everybody is on the front lines, if you will. You have ICU docs and ED docs that are obviously at higher risk than, let's just say, those that are in podiatry and other types of specialties. And so there's going to be a prioritization within that group in and of itself. And the New York State interim plan does have within the matrix how the allocation is going to be given to the healthcare workforce. So I think this is we're just waiting on more information, but this is very much in collaboration with our public health partners.
Okay. And when we move to audience questions, Dr. Koff, I wonder if you think that the states generally are ready for this giant mass vaccination campaign, the likes of which we in our generation certainly have not seen before. Do you think there's going to be a lot of bumps in this process, or do you think everybody's as well prepared as they can be?
Unfortunately, I think there's going to be a lot of bumps. I think one of the issues that is really under the table is we do an extremely effective job each year with all the licensed vaccines that we have in terms of giving vaccines to infants and kids. In contrast, though, the record of the vaccines that are for the elderly and for adults have not gone as well. And so on the annual basis, the influenza vaccine, the uptake of the influenza vaccine is about 50 or 60%. So we've got a lot of work to do, and we've argued that there should be a series of the demo projects immediately to really learn how to get these vaccines to the people that are going to need them the most. So I think this is going to be a military operation. I think it's going to be huge logistics operation. There's a lot of excellent people that are working on it now. But I think, unfortunately, I think we're going to see a lot of bumps in the, in the road as some of the governors in some of the states have still enabled states to be wide open without masks and such. I just think that, the country is really big, is really diverse. Hopefully I'm wrong, but I just think this is, 300 million doses that you have to get out, or 600 million doses, because each of the vaccine is going to be, given at the initial day and then about a month later or so. And that's going to be an additional point in terms of ensuring that all those people are going to come back and take a second dose.
Sure. That is a huge challenge.
Yeah, one thing that I'll just quickly mention, because one thing that I don't see being discussed enough in a number of different panels is, we talk a lot about the distribution of the vaccine and the shelf life and how it's going to be administered, but there's a huge information technology component to it, making sure that the data science is obviously, and the vaccine registries are up and running across the states, across all localities. And then there's also the post-vaccine monitoring. So that's another really big thing that is also being considered, and how to roll that out consistently, and making sure that all of that, is up and running in a timely fashion. So there's a huge IT component to all of this.
Yeah.
The only thing that I'll also mention is, as you know, and this is public information, the cyber threats are hot and heavy right now in the United States. And so, healthcare systems are already, they're bracing and they're preparing for what if our own electronic medical health system goes down in the middle of the surge. And now we also have to think about, when the vaccines roll out, there's going to be a huge IT component. What if there is some sort of a cyber threat on the registries? And we know that a lot of these vaccines are 2-dose, meaning there's going to be a 3 to 4 week interval. So there's going to be a lot of considerations that are going to be baked into all of that.
Right. That's a pretty terrifying thought, to think of not suddenly losing all your information about who's had 1 dose, but not the follow-up dose yet. Just quickly, Dr. Lauterbach, are you expecting some bumps in the road with your rollout? You have a somewhat smaller population than ours, but I assume each region of Germany is planning its own rollout. To how broken down is the distribution planning and process?
Well, I agree with Dr. Madat and with Dr. Koff that there will be bumps to be expected. This is true in Germany as well. We also have a population of 83 million to serve. So this is a giant operation which we haven't had in the past. There is nothing experience-wise we can link to. So therefore, we will roll out, initially we plan to roll out about 60 centers nationwide in order to cover the population. But now we have already recognized that this number of distribution centers will not be sufficient. But we will establish new distribution centers, vaccine distribution centers, which are secured by German army and which are, let's say, supposed to be protected also by, let's say, IT and intelligence specialists, because we are aware that there may be threats to both, let's say, the software, let's say, the data, but also to the centers themselves. Physically speaking, we have an anti-vaccine movement here, which is is a small movement, but it is militant, so we have to be aware of that. And we will try to protect what we consider to be an ultimately extremely important resource for the population. These vaccine centers, we will build them up as quick as possible. We plan to do so in the next 4 weeks. So we want to be prepared to deliver the vaccine by the end of December. From having talked to, let's say, a couple of the medical directors of the vaccine companies that are currently addressing approval in the US and also in Europe and in Germany, we expect to be able to vaccinate a part of the population already by the end of the year. And we try to have established these vaccine distribution centers then, and we will basically try to establish them by the states. So all of the 16 states will have their own campaign to establish the centers, but it will be a copy and paste center system where, let's say, a standard center is duplicated in many cities and in many communities.
Okay, sounds like a smart approach. Okay, I've been greedy with my questions, and it's time for some questions from the audience. So this is a question for all of you from Suzanne Linehan-Winter. Is there a particular vaccine that each of the panelists is more optimistic about than others, and why? Anybody jump in?
Well, I think it's a little early to say. You know, I think if we were kind of 6 or 8 months up the line, and we had the data on the first of 6 or 7 of the vaccines, I think it would be relatively easy to answer that question. But at the present time, you know, one, we haven't seen any of the data. We've only seen the announcements from the companies. So the data is coming out relatively soon, and then there are the other 3 or 4 vaccines that are right behind in terms of the data. We saw some of the announcements of AstraZeneca last week. It's very likely within a month or 2 we'll see additional data out of Janssen in Novavax, whose data in the initial trials has been as good or better than the other vaccines. So I'm really optimistic that we're going to have a number of vaccines at the end of the day that have efficacy in the 90% or so range. But it's a little bit early to pick a horse, basically, if you were going to pick a horse in the race.
Do both of you other panelists agree with that? Or if briefly, if there is one vaccine you feel particularly confident about, let us know.
Yeah, so I think I completely agree with what Dr. Koff mentioned. I think the only thing that I'll probably add on to is I don't think you may have a choice early on. It depends on whatever you're given in terms of the allocation to that state. But you know, I think that it's too early to ask the question in terms of do we prefer one over the other right now.
Okay. And
yeah, I agree with the two. As a panelist, it's too early to say, but from the preliminary data that we have currently been in a position to see, which were basically company data, I would say all 3 of them so far would be good enough for me.
Good to know.
I mean, one of the things, Abby, the other point I want to make is if the data at the end of the year at the Janssen vaccine, which is also being looked at as a one-shot vaccine. If that vaccine is as good in a one shot as the others are in 2, I think that'll
solve a lot of problems.
Everything, right? And solve a lot of problems.
Right. Good point.
The only thing that I'll also just quickly mention is there's really a big distinction between efficacy and knowing that a vaccine is effective. We won't know how effective a vaccine is until it's actually broadly available to the general public. And so going back to Dr. Koff's point, time will tell how effective a vaccine is. And so we know that efficacy is over 90% for these vaccines, but no.
In the first 2 months of data.
Yeah, exactly. First couple. So once this is rolled out, it'll probably be lower than that. But you know, again, this is something that's going to be very closely monitored.
Okay. Can one of you address this question, which is one I hear a lot? This is from Liz Carr. What about vaccinations for kids? Is there a plan when we can expect a COVID-19 vaccination for them? Any of you know the specifics on that? I know that Pfizer, I believe, has started testing in kids as young as 12.
Right.
I'm not sure about the others.
I think, Abby, I think that all the vaccines, as soon as the regulatory agencies have looked at the initial safety data, I think there are the initial plans then to begin to move down in terms of the age. And I think that's really, really important because it's unclear if the elderly are getting these, the virus, on the basis of interacting with other adults and elderly, or if the kids and the grandkids are bringing it, you know, into the homes of the parents and the grandparents. And, you know, most of the kids have been asymptomatic. And so it's really important to see, you know, these vaccines evaluated in the kids, and secondly, to understand how well any of the vaccines are going to work in terms of a block of the infection from one person to another person. Because until now, all the data has really been on the efficacy against the disease and not against the infection.
Right. Very good point.
Yeah, I agree. I agree. In Germany, we appear to see fairly robust data that children infect each other and infect adults and get infected by adults, but they have only minor symptoms and rarely get lasting problems. So if the vaccines do not, let's say, prevent becoming infected and may not even prevent the infected to pass the infection to others, it would make no sense to vaccinate children.
Yep, seems really urgent to get the adult population vaccinated first, especially when we're talking about teachers, for example, versus children in a school. A panelist, an audience member asks, I'm a German doctor. One problem is to get the vaccine. Another problem is to have enough doctors to vaccinate people. Is there a similar problem in the US? Anybody, first of all, is that true that Dr. Lauterbach, that there may not be enough German doctors to, you know, do a rapid rollout of vaccination to everybody?
I don't think so. I think we will be able to solve this problem because we currently are in a major recruitment effort of doctors, even retired doctors, to provide the vaccination. So I do not think that ultimately that will be a bottleneck for us to have enough doctors to do that. And indeed, if we do have enough, let's say, a vaccine available, we will clearly be able to make the vaccine available. We may even recruit medical students, because if there is, let's say, close monitoring of the patients in the, let's say, in the following 30 minutes after the vaccination by doctors, there is no reason why not medical students should do the vaccinations themselves, or even nursing personnel. So therefore, I don't agree, and I may be mistaken, but from what we currently prepare, we do not, government-wise, we do not expect this to be a major threshold to making the vaccine available. We do see bottlenecks, but this is not a particular bottleneck about which we are very worried at the moment.
I see. Okay. And I assume we do, because we're using pharmacists and all sorts of, you know, nurse practitioners, et cetera, that we will have enough providers registered in the US. Next, I'm going to move on because we're running out of time. From Jorg Ehrman, what lessons can we learn from SARS COVID vaccine development for potential future pandemics or diseases? Who would like to take that one? Are there any lessons in what we've seen in terms of vaccine development, the very rapid vaccine development over the past year, to take forward?
Well, I think in terms of vaccine R&D, I think the genie's out of the bottle. It used to take a decade in development of essentially any vaccine, and now we've seen, with this unprecedented effort, but the ability of doing what used to take a decade within a year, or within 18 months. And I think the companies now that are making other vaccines, such as the the influenza vaccines and the respiratory syncytial virus vaccines and dengue and others, and vaccines for Alzheimer's and cancers and such, are going to be asking the regulators if they can accelerate on the basis of what has been done here.
Right.
So I think in just in terms of the R&D effort, I think we can see major changes.
Okay. Quickly, anybody want to follow up on that?
No, I fully agree. And in particular, apart from, let's say, the regulatory improvements and what we have learned about that, I also think that, let's say, the messenger RNA platforms, that is also something that we have learned. And I think that these platforms will not only be made available to different vaccine efforts, but also for, in particular, cancer vaccination and possibly even Alzheimer. So therefore, this is, I mean, scientifically speaking, this is, and Dr. Koff put it very eloquently, genie is out of the bottle in that respect as well.
Yeah.
The only thing that I'll just quickly add on is in emergency management, we have a saying, never let a disaster go to waste. And I think the silver lining in this particular pandemic is exactly what the panelists have mentioned, is that this has completely transformed our development process for vaccinations moving forward. So this is certainly a historical moment for public health and healthcare throughout the world that we can capitalize on moving forward.
Okay. Yeah, that's going to be fascinating to watch. One last question for all of you, touching on some of what we talked at the beginning, but I think such a pressing theme moving forward. How can we increase the public's trust in vaccines overall? And what are some of the unique challenges around the COVID vaccine in particular? That question comes from Dima in the audience.
So I'm happy to start. So I think that the key is, we all have, as I mentioned, guiding principles. And I think part of those guiding principles is transparency and safety, and making sure that you are having public health experts lead the conversation versus individuals that are non-public health experts. And I think a lot of this is going to stem from the trust. So, there's been so much chaos and bad information that's been put out there. And I think now is the time to build that trust with our respective populations to make sure that they feel safe, that they're getting a vaccine that's going to actually be effective and is going to save lives. And so I think that's really, really important. And we're seeing a lot of the breakdown of who is hesitant, what they're hesitant on, and looking at some of the categories of, the priority groups of who's going to get vaccinated. So just among healthcare workers, there is hesitancy. And so we need to make sure that we are addressing this head on. So there's a lot of tactics we can use, but it's all boiled down to trust and transparency and making sure that we're all saying the same message.
Okay, great. And in closing, I want to ask all of you, every panelist, to share one thing that you feel the audience should take away from this discussion about the vaccination effort moving forward. Dr. Kopp, let's start with you.
So the one thing I would say is these vaccines are extremely safe, and as soon as they come out, everyone should take the vaccine.
Short and sweet and to the point. Thank you. Dr. Lauterbach.
Well, I agree with what Dr. Koff was saying, and I would like to make a more general point from the entire endeavor of, let's say, trying to get the vaccines out and managing this pandemic. We can learn how much we will need to rely on science, trust, and transparency, but start with the science if we want to manage future challenges. And this does not only include future, let's say, pandemic challenges, but in particular the climate challenge. So if you want to manage the climate challenge in the future, we should also look at what we have learned from dealing with the COVID crisis.
Wise words. Thank you. And Dr. Medad.
Yeah, I mean, I agree everything the panelists have mentioned. I think the only thing that I'll add is there is obviously light at the end of the tunnel. We will get out of this pandemic, and these vaccines have the potential to end this pandemic, but it depends on obviously making sure people actually get vaccinated, that we have good coverage. And I think between now and then, it's really, really important that everybody continues with these preventative measures. And when we talk about wearing a face mask, it's something that everybody can implement on a daily basis when they're in contact with non-households. This is not like a ventilator that requires 600 parts to build, or a pharmacy or vaccine that has a very large development and research component. This is something so simple and basic. And so right now, with cases increasing everywhere, we need to continue with these preventative measures, knowing that it will be light at the end of the tunnel with these really safe and efficacious vaccines being rolled out soon.
Right. So important to mention we are still in the tunnel and we'll be there for a while, even though that light is there. Thank you to the three of you so much for such an interesting conversation about the most fascinating thing to be reporting on right now. And I'm going to turn things over to Jeremy Martinez to close things up.
Hi, everyone. My name is Jeremy Martinez, and I'm one of the organizers for this event for the 2020 German-American Conference at Harvard. I'd just like to thank all of you for sharing your time and thoughts with us today. The topic of the COVID-19 vaccine is one of both profound global interest and worldwide importance. I look forward to seeing how things progress in the coming months, and I remain cautiously optimistic that the pandemic will soon be brought under control, not just for Americans and Germans, but everyone affected by the coronavirus. So this marks the end of the COVID-19 vaccine event, but not of this year's German-American Conference. Please join us on December 2nd for an event on AI, its potential applications within the field of education, and the challenges AI may present to future learners and educators. Once again, thank you to our speakers, Sarah Madad, Karl Lauterbach, Wayne Koff, our moderator, Abby Goodenough, and to you, the audience, for your questions, time, and attention.